Hello, and welcome to Focused In, a new feature of the Curing with Sound podcast presented by the Focused Ultrasound Foundation. I'm your host, Allison Preston Smith, and I'm here with one of the foundation's resident experts. Can you introduce yourself and your title?
Yeah, of course. Hi, Allison. My name is Lauren Powlovich, and I'm the Associate Director of the Research and Education team here at the Foundation. And I'm also the Director of our Brain Tumors Program.
And Lauren, you oversee our pediatric programs. Can you tell us about a disease called DIPG?
Yes, DIPG, or otherwise known as diffuse intrinsic pontine glioma, or also it can be called diffuse midline glioma or DMG, is a rare and aggressive form of brain cancer that occurs most commonly in children. It occurs in the brain stem of the brain, which is in the lower portion of your brain. And this is where your vital functions are controlled, like breathing and your heart rate. So it makes this a very devastating brain tumor.
And what is focused ultrasound being used with the treatment, or how is it being used in the treatment of DIPG?
Well, before I get into that, I want to explain to you some of the challenges about why DIPG is such a difficult tumor to treat. And I already mentioned one of those, and that's due to the eloquent location of these tumors. So they are unable to be surgically resected. And for that reason, the standard of care treatment for these brain tumors is actually radiation therapy and chemotherapy. However, there is a challenge that's been identified with delivering chemotherapy to these brain tumors, and that is that these tumors have a partially intact blood brain barrier. The blood brain barrier is a protective layer of endothelial cells that is specific to the brain. And it is great for healthy brain tissue because it keeps toxic substances and harmful things like bacteria out of the brain. So it keeps your brain safe. However, when you have a disease or condition like brain tumors, where you need to deliver medications to the brain, this blood brain barrier then becomes prohibitive in nature and doesn't allow the drugs to enter the brain in the concentrations that we would like them to be delivered. So, focused ultrasound is being used to overcome the blood brain barrier. That's one of the mechanisms that is being investigated for treatment of DIPG. And with that, we use what's called low intensity focused ultrasound. And we combine that with microbubbles, which are injected intravascularly to temporarily open the blood brain barrier. And this mechanism has been shown to disrupt the blood brain barrier for anywhere between 6 to 24 hours. And this allows us to then administer drugs like chemotherapy and immunotherapy for brain tumors to bypass that protective layer of endothelial cells in order to increase the concentration of chemotherapy and immunotherapy into the brain. So that's one of the mechanisms that's being investigated for use with focused ultrasound. And then there's actually a second mechanism which also employs low intensity focused ultrasound called sonodynamic therapy. And with sonodynamic therapy, we're using the ultrasound energy to actually activate a non toxic substance into a toxic one. And that's called a sonosensitizer. So there are some trials that are investigating sonodynamic therapy for DIPG as well.
And what's the foundation doing to advance treatments for DIPG?
Yeah, so we are very supportive of research in these areas. So we are actively funding 3 clinical trials, which are investigating focused ultrasound blood-brain barrier opening in combination with a chemotherapeutic agent to treat DIPG. 2 of those studies are looking at low-intensity focused ultrasound plus microbubbles to treat in combination with doxorubicin for DIPG, and the other one is using low intensity focused ultrasound with microbubbles in combination with a chemotherapeutic drug called etoposide to treat DIPG. And those studies are happening at 3 institutions: Children's National, Sunnybrook, and Toronto Sick Kids combined as one institution, and then also Columbia University.
Mhm. Well, thank you so much for sharing your expertise with us and with our audience, Lauren. We really appreciate it. And stay tuned for the next edition of Focused In.
Yes, thanks for having me.